Hello and welcome to this lecture. In this lecture, we are going to discuss the common OTC drugs that is available in the market. And number one, we have analgesics for relieving the pain, such as ibuprofen and aspirin has been used for painkiller. Then, pain actually is what is actually a pain? It is actually a big word because it could be vary in intensity, whether it is mild, moderate, or severe. Sometimes for severe generalized pain, we give anesthetics. Even during surgery, we give anesthetics so that the patient does not feel the pain while surgery. Sometimes the pain is superficial on a certain part, like on your body, on your feet, on your hand, and you give analgesics. So there are two classification of the pain. One is anesthetics, one is analgesic, and they are classified on the basis of their effect either on system or on their periphery, or it is mild to moderate or severe. So it's quite a big topic. When we talk about anesthetics and analgesics, the meaning of anesthetics have that effect. They reduce all type of sensations by blocking consciousness. So it means the patient is not in under conscious, he is not feeling anything. Whereas the analgesic is also responsible for reducing the pain, but it is selective, or the loss of sensation in only selective part. So the drug we use is aspirin, which is used more than 2000 years ago, extracted from the willow bark, and it is used for the treatment of pain, gout, and other illness. And then American Indians use that willow bark to reduce the fever. And this discovery was rediscovered again 200 years ago when an Englishman, Reverend Edward Stone, prepared the extract from the bark and gave the same dose to 50 people, 50 patients with varying illness, and found good results. In the 19th century, the active ingredient was isolated and was identified as salicylic acid. In 1839, salicylic acid was synthesized, and then bulk production was being made more, and then it was used for many illness, especially arthritis, which is the inflammation of the joints. He synthesized in 1898 for the treatment of stomach upset and was found relief from that, and then it was released for sale in 1899. The therapeutic use of acetyl salicylic acid is it is analgesic. It is block the somatic pain, mild to moderate. It is also antipyretic for reducing the fever, and it is anti-inflammatory as well. So it is using for reducing the swelling, inflammation, or soreness in the injured area. The adverse effect of aspirin is that it can increase the chance of bleeding because it is also used for thinning the blood. It also inhibits the platelets, and whenever you have any cut or wound, the platelets is important because your cut or wound can be healed by platelets. But is the problem with the aspirin that with the use of aspirin, the platelets aggregation stop, and then it can cause number of complications. The treatment of reinfection with aspirin is not a good idea because the treating of the chickenpox or influenza under the age 20 with aspirin can lead to Rey syndrome, which is the swelling of liver and brain. Then we have acetaminophen, which is used for relieving the pain, but it is better having less disadvantages as compared to the aspirin and more safer. But the overdose of acetaminophen can cause liver disorder. This is an article I found that chronic excessive acetaminophen use can cause liver damage. And when I take a look of this paper, I found that this paper is written quite old, I think 50 years old, and in that time they also mentioned the excessive use of acetaminophen can cause the liver damage. Then we have ibuprofen, which and other NSAIDs such as ibuprofen is used for anti-inflammatory and the treatment of arthritis, but it having some disadvantages like headache, dizziness, heartburn, nausea, stomach upset, ringing in the ears, bloating, constipation, and diarrhea. And then the other cold and allergic products for the treatment of common cold. There is actually no products that can be used for the treatment of especially viral infection with especially the cold and allergic products, because antihistamine are products that are used for the treatment of cold and cough or allergy. They cannot be treated with the available products. And we know that common cold can be caused because of the viruses like rhinovirus or coronavirus. And the problem is that rhinovirus, when we talk about it, can spread through droplets, through nasal secretion, or through contaminated objects. As currently we are under have coronavirus, people using different uh, cold products, but most of them are not treatable, because still the research is going on to find an effective treatment for coronavirus, especially for COVID-19. And I mentioned in the slide that 40 to 60% of individuals with cold, researchers cannot connect the infection to the specific virus. It means that they are unable to diagnose the virus, which specific virus, because virus change themselves very quickly. So this is a problem in that case. But how can we avoid the virus? Some of the things that we can do, we can protect our mouth, our face, because through nasal mucosa it can be spread. Then we need to understand, we need to keep our skin dry, non-porous, so that to keep our skin dry, it can be helpful to avoid. And most of the virus can enter into the nostril and eye, so we need to protect our eye and nostrils. So when we talk about treatment for the cold symptoms, there is no practical way to treat, but we give some antihistamine, some analgesic, cough suppressants, some drug like phenylephrine. These are drugs with different brands, as mentioned in table 12.3, produced by different companies. But again, the question is that if these products are not treating the virus, then why are we giving them? This is a question, because billions of dollars has been spent to treat the viral infection with these drugs. So the answer that some of the doctors said that sometimes we giving antibiotics such as well, for example, to prevent other type of infection caused by the virus. So to prevent the other infections, we give the drugs such as the use of antibiotics, or for example, why we give antihistamine to prevent the allergic response. So we are not treating the virus, actually we are treating the symptoms that viral infection produce. So that's actually the reason, a justification we have, although we don't have any definite treatment for viral infection, and very few drugs has been available. So allergy and sinus medication, antihistamine has been used for runny nose and for nasal decongestion and for reducing the swollen sinus passages and to treat sinus headache. So when we talk about common OTC drugs, we have aspirin, acetylsalicylic acid, acetaminophen, caffeine, and dextromethorphan, diphenylhyramine, phenylephrine. These all drugs has been common OTC drugs, and they have been misusing. And they have not mentioned one of the product that we discussed before, like the use of the loperamide. We discussed before that it is also dangerous because it is anti-diarrheal drug, but this anti-diarrheal drug is responsible for euphoric effect. This is another research that has been found that the use of acetaminophen with the hydrocodone, which is used in the cough syrup, has been misused, and that result in ototoxicity, and it can affect the ears, like ringing ears problem. Then another article that I found on it is the use of energy drinks and dietary supplement energy drinks, but a recent research found in 2012 that the use of excessive energy supplement can lead to hepatic toxicity. It means it can damage your liver. So you can read this paper in detail. Then amphetamine abuse is the common abuse we discussed several times in different topics. And a recent research in 2016 found that the misuse of amphetamine can lead to myocardial infarction. So the students that are interested to use during their studies, I will never recommend any student to use amphetamine as a stimulant or any drug, because these are not good for your health for longer term. Thank you so much for today's lecture. Hope to see you again.